Hi, I'm Michael Herger, and I'm here to tell you about our team-based project called Building Capacity to Support the Pandemic's Unsung Heroes, Frontline Essential Food Service Workers. I'm leading this project in partnership with Courtney Baker, and we're also working with the Louisiana Public Health Institute, many members of the community, and various students at Tulane. First, our agenda. I'll describe our community of interest, the target problem areas we're seeking to focus on, the rationale for this project, describe our steering committee, and the various activities that we'll conduct through this project. So first of all, this project is focused on frontline essential food service workers. These are people who've been unsung heroes during the pandemic. They are largely working in very social occupations where they're at much higher exposure risk for COVID, and they're doing their best to make sure that people have the most essential thing they need, food. And so we're really focused on anyone who has some involvement in the food services industry. This could be people working as cashiers in grocery stores, restaurant employees, anyone in food transportation, anyone who is working behind the scenes in these occupations, really anyone who is in some sort of social occupation related to food. Overall, this project focuses on three core needs related to the pandemic. So one is health and safety. Like a lot of people who are working in the food service industry have to make decisions about vaccines and now also boosters, decisions about masking, distancing, and various other precautions. People are experiencing stress related to the pandemic and illness, things like worry, sadness, anger, bereavement, and all sorts of other stressors. And then there's the long-term impact of the pandemic. This could be having long-term symptoms of COVID itself, or it could just be the long-term impact of the stress of the pandemic on family, or how the pandemic has affected people's finances. And obviously these issues are affecting just about everyone, but they are really hitting people in the food services industry and also their family members. So I'm gonna start by just providing a rationale for why we're focused on people who are working in the food services industry. I'm going to start with a brief timeline of the initial few months of the pandemic. So this timeline is going to show the silent spread of the virus in New Orleans and how this preceded the World Health Organization's pandemic declaration, as well as the national mask recommendations in the US. So the first part of the timeline I'm going to show is the silent spread of the virus in the US. And on the top part of the timeline, I'm going to show what's happening in New Orleans. And on the bottom part of the timeline is what's happening in the US. So in January of 2020, we had the first reported case in the US. And we did not see the first known death until late February. And of course, in New Orleans, and the time in between this was parade season. And so this was an extremely vulnerable time where New Orleans was highly at risk and there was silent spread of the virus going on and not really a lot we could do about it because we didn't know this was such a risk. Going forward in the timeline through April, we start to see COVID actually being diagnosed. We see people getting hospitalized and we see deaths. And so on March 9th of 2020, we saw the first known case in New Orleans. And this was just 2 days before the World Health Organization's pandemic declaration. So really it was hitting people in New Orleans right as the world was just starting to become aware of how big of an issue this was. And New Orleans acted pretty quickly. So schools closed within 2 days of the pandemic declaration. And just less than a week later, California had issued a stay-at-home order, and Louisiana was actually only a few days behind that. By early April, we saw a peak in COVID cases in New Orleans, and that was even with considerable difficulties in testing and diagnosing people. And so the numbers we have may be a considerable underestimate of the total number of actual cases at that point in time. And I point out that this was such a severe problem, and it actually happened before nationally we had a recommendation to use face masks. And so this just shows how vulnerable people in New Orleans were, that all of this was hitting everyone at once. And it was before it was really understood as a serious problem. Of course, after our peak in diagnoses, we had our peak in deaths about 2 weeks later, and that peak in deaths remains. And so this is really a product of just lack of national guidance and worldwide understanding of how severe a problem this was. So there really wasn't a lot New Orleans could do. And during the Delta surge in August of this year, we did see a higher elevation in known cases, but it is quite possible that even back in April 2020, that was our highest level of cases. And so I just go through this timeline to remind everyone of how vulnerable people were in New Orleans, and especially people who were working in social occupations, often in restaurants and grocery stores and other settings where they were interacting with a lot of people during this time period and had a lot of risk. And of course, those risks continued on, and there were also economic impacts of working in this area too. So reviewing how the pandemic has hit people in the food services industry, we saw at the start of the pandemic, this group of people was basically the earliest to experience an increase in exposure risk. Around lots of people, more risk, especially when we didn't have masks and other precautions in place because we didn't know the significance of the issue. Every time there's been restrictions lifted related to distancing, occupancy rules, masking, often people in the food service industry are among the earliest to experience that increase in risk just because of being around so many people all the time. Of course, there's also financial impacts of the pandemic. So business owners are going out of business at times, and the recent hurricane has exacerbated that too. We have people being laid off or having hours cut, people working and not getting back pay, people losing health insurance. Some people are having to quit their jobs or reduce their hours because their children are in schools and the schools can't stay open, and people are incurring longer term debt and other financial consequences. Other impacts related to vaccination. When the vaccines were first being rolled out in the US, despite people in the food service industry having a higher than average occupational exposure risk, they were among the last group of people to actually become eligible to receive a vaccine. And as of today, there's talk of a third dose of Pfizer and likely additional doses for the other vaccines as well for a larger group of the population. The framing around this is not great, but it's a little better than with the initial vaccine rollout because there's a greater acknowledgement of occupational risk and being in social occupations where you're going to be around people. So this is improving, but we still have a lot to do in terms of clarifying to people that if you're in a social occupation, you may be among the groups of people who can consider getting an additional vaccine dose early on. In addition to that, the pandemic has affected people in terms of stress and also long-term impacts on health and their stress and their finances, as we've gone through. Okay, so we're targeting these 3 problem areas, and the goal of this project is really building capacity. So we're trying to understand these problem areas most effectively and see what we might be able to do to then build on that understanding and help address these 3 problem areas of health and safety, stress, and long-term impacts. Accordingly, the project has several objectives. So the goal is to build objectives to target those 3 problem areas. We're going to do this by developing a multi-stakeholder collaborative. A stakeholder is simply an individual who brings unique expertise and experience. And so we're bringing together a large group of people who have different types of experiences and different areas of expertise so that we can work together more productively. We will engage a broad community of stakeholders beyond those who are in the leadership roles within the steering committee to understand these problems more effectively. And over the next 18 months, we're going to develop a strategic plan so that we can address these issues most optimally over the long term. So this is what we envisioned for our multi-stakeholder steering committee, the group of people who are going to help lead this project. And this is a complicated figure, so I'm going to walk you through different parts of it. But these are just showing some of the roles that people will have in leading this project. So if we look at the yellow rectangle on the top of the figure, we've got community stakeholders. And in the green boxes, we've got people who are working in food services. We're imagining 3 people who would be on the steering committee who are working in restaurants or grocery stores or other food related occupations, and 1 person who's in more of a managerial sort of capacity. And what we acknowledge is that the impact of the pandemic on people in the food industry is not just impacting those individuals, it's often impacting their family too, if they have family. And if they have children, it often involves their schools, because schools are the place where children need to be safe as well. So we've decided to involve family members of people in the food service industry, and we also have a representative who's worked closely with schools. And so, in terms of stakeholders that we've involved to date, we've got Clay and Brian, who are in the food service industry, and we've got Kathleen, who is a longtime collaborator with schools, and we're looking to fill a couple of these remaining spots in the near term. Down in the red box, we've got our academic people. So this is me and Courtney, and we're approaching this from the academic angle. And in between, we've got these orange boxes, which are people who are focused on integrating community stakeholders with academics to solve these problems from different angles. And so our main community academic liaison is Beth, and her partner is at the Louisiana Public Health Institute. And then we've got sort of these liaisons in training, Ken, who's a grad student, and we've got various undergraduates who are also going to be contributing a lot to make this project a success. In addition to these people on the steering committee, the idea is that we're going to be engaging the community. We're going to be engaging people from each of these different constituencies to understand their perspectives and really organize around these issues. Our guiding framework focuses on 3 main components. So we've got collaborative learning. This is the idea that everyone on the steering committee and everyone who's involved in any of our activities brings different types of experience and has different expertise. So everybody brings something to the table. Everyone is also going to have things they don't know. And so we don't expect people who are community representatives to understand all the scientific jargon that we're going to talk about. And in the same way, I don't know what it's like to be somebody working in a restaurant right now and the different challenges that you face in that regard. So everyone has their own expertise, and we hope to learn from each other. We emphasize shared decision making. So this tries to bring equal power among all people on the steering committee to share and have a voice in making decisions. And then we emphasize partnership. We want to emphasize equity, reasonable expectations, transparency, honesty, and trust. This is the timeline of activities we've proposed for this project over 18 months. And this is very detailed, and I could expand on this quite a bit. I'm going to walk us through it, but just wanted to give you the big picture first of all. So this is starting September 2021 and is going through February 2023 with the idea that we're going to build on these initial activities to develop more broader projects over the future. So just focusing on what we've got going on the remainder of this year, September 2021, our goal for this month is basically just start to lay the groundwork for this project, hold our steering committee meeting. Obviously, with the hurricane hitting, people are relocated all over the US. And so we've modified what the steering committee meeting looks like for this month. I've recorded this presentation, and then we're going to meet in a large group, and then people who can't make the large group steering committee meeting, I'll follow up with either for individual meetings, or we'll do some small group meetings And we're allowed to extend that over the next couple weeks since people are still being greatly affected by the hurricane. And my hope is that for future steering committee meetings, that'll look like a more cohesive large group meeting. The steering committee meetings are scheduled for every other month, so we'll have another one in November. And then our other main activities that we're looking to accomplish this year are basically two things. In October, we're going to have sort of a town hall meeting. This will be through Zoom, presumably. And the idea of this is just to bring in more interested people from the community and explain to them what we're doing with this project, get them up to speed a little bit more on some of the scientific terminology and where we're looking to take this over the long term, and really start to get people's feedback and guidance on where we should be taking things. In December, we're going to hold a training meeting, and this is basically designed to help people who are members of the community who are interested in these topics, but don't typically have a scientific background. And so we're going to start to lay out, here are some of the scientific terms, here are some of the scientific principles, here are some of the things that we can work through together to prepare us to go out and then get larger grants to fund projects to address these issues most successfully. And so you'll see, various terminology throughout these sorts of slides, and it's okay if you're unfamiliar with these. For example, here there's a term that says PCOR/SARE, and PCOR, PCOR, is just patient-centered outcomes research. It basically means research that is focused on outcomes that matter to patients, or in this case, it can be outcomes that matter to a community, as opposed to just outcomes that solely matter to scientists. CER or SARE refers to comparative effectiveness research. And this is just looking at conducting research where you have two or more ideas of how to solve a problem and you're comparing them head to head. And so these are some of the topics we'll go into because it can help to bridge the gap between people with an academic research background and people with real world community experience, so that we can collaborate more effectively in getting funding to go dive into these issues. Here I've put the whole timeline up again, and I'm just emphasizing that there's a steering committee meeting that's to be held every other month. Other project activities will focus on understanding what's going on in the community, especially among people who are food service workers or their families or other people of interest in these issues. And so we will conduct a survey by the end of February to understand these issues, especially related to health and safety, stress, and long-term impacts of COVID. We will hold some advisory groups or focus groups, groups of about 10 people. And these will be held in April, June, and October. And those will focus on the three problem areas of health and safety, stress, and long-term impact. And then in December of 2022, we will do a rapid qualitative assessment. And this is fairly open-ended. So what it could look like is it could be a series of interviews that we conduct with people in some unique setting. If we were to conduct this type of assessment last May, when we submitted the proposal for this project, we might have gone to a community vaccination site and interviewed people there to get their perspective on these issues. The pandemic is evolving, so we don't know what the most optimal setting will be in December 2022, but we'll have an opportunity to go and really try to target a group of individuals that we think will yield the most useful information and conduct some interviews with them. All of this is evolving. And so in our proposal, we basically laid out some ideas of what we might do under a best and worst case scenario. And that could look very different depending on the nature of the pandemic. If things have greatly improved, then a lot of what we're going to be focusing on is dealing with the long-term impact of the pandemic, how people are still being affected even when the acute crisis has gone away. On the other hand, if there's a worst case scenario, like there's a really bad variant that is causing vaccines to be much less effective, then we're going to be focused on a lot of the acute issues more related to health and safety and trying to keep people and their families safe. And obviously, it could be somewhere in between all of this. But that's our general framework. Okay, so we've got steering committee meetings, we've got various surveys and focus groups and things like that. And then this slide is showing that we're doing different sorts of trainings and engagement activities with the community. So I've mentioned the town hall, where we're going to engage people from the community, start to organize, explain to more people what's going on with this project. We've got a training we'll do in December and another one in August 2022 that are focused on explaining more of the scientific concepts to help people in the community feel more comfortable engaging in a project like this. And then at the very end of the project, we're going to have a meeting that's kind of like the initial town hall, but it's more forward looking, and it's talking about how we're going to disseminate or spread the findings of what we've learned through all this and what our next steps are in terms of strategy and carrying this work forward, and hopefully doing so with larger funds and more effective means of grappling with these problems. So I want to thank all of you for listening. Please contact me with any ideas, any ways we can improve this project. Let me know if you want to be involved or if you have ideas for how you can be involved. Please feel free to share this information with friends and families and coworkers. And I really appreciate you and hope you'll reach out with feedback. Thank you very much.